Picture yourself giving someone CPR. The person is lying on the ground in front of you, and you're pushing hard and fast in the center of this person's chest. What is CPR doing to the body to help keep the person alive? Try to visualize how CPR is helping save this person's life. When you give compressions during CPR, you're acting like the heart, helping to push oxygen-rich blood to the brain and the rest of the body. This can help someone survive when his or her heart stops beating. You've probably heard the terms heart attack and cardiac arrest before. You might think a heart attack and cardiac arrest are the same thing, but they are not. There are some very important differences. The major difference between the two is that during a heart attack, the heart is still beating and pumping blood, and the person is still alive. During cardiac arrest, the heart has stopped beating and the person doesn't respond and isn't breathing normally. A heart attack occurs when a clot forms in a blood vessel carrying oxygen-rich blood to the heart muscle. When the heart doesn't get enough oxygen from the blood, the muscle starts to die. A person having a heart attack needs immediate medical treatment. If the blocked vessel isn't reopened quickly, the muscle normally nourished by that vessel begins to die. Typically, during a heart attack, the heart continues to pump blood so the person doesn't need CPR. The longer the person with a heart attack goes without treatment, the greater the possible damage to the heart muscle. Occasionally, the damaged heart muscle triggers an abnormal rhythm that can lead to cardiac arrest. Anytime the heart stops beating, it's called cardiac arrest. Heart attacks aren't the only thing that might cause cardiac arrest. Cardiac arrest can also be caused by problems such as severe injuries, drowning, and drug overdose. When the heart stops beating for any reason, a person needs CPR immediately. You might think cardiac arrest happens only to older adults, but the truth is, cardiac arrest can happen to anyone. It can happen to a high school athlete, a family member of any age, or even a child or infant. It's really scary to see someone in cardiac arrest, but if you phone 911 and start CPR immediately, you can help save that person's life. Don't be afraid of doing something wrong. This video will help you learn what to do so that you can give CPR and help save a life. Imagine you're at a school athletic event when you witness a man suddenly collapse in the bleachers next to you. We're going to teach you exactly what to do. The first step is to make sure the scene is safe. Look around you to make sure you aren't in danger. Next, tap the person on the shoulders and shout something like, "Hey, are you okay? Are you okay?" If the person doesn't respond, you need to get some help. Shout to see if anyone is nearby. Say something like, "Help, somebody help me." If someone arrives, tell the person to phone 911 now and get an AED if it's nearby. If no one comes to help you, you'll have to phone 911 yourself. If you have a mobile phone with you, phone 911. Use the speaker mode while you talk to the dispatcher so that you can leave both hands free to start CPR immediately. If you don't have a mobile phone, you'll have to leave the person to phone 911 and get an AED yourself. The dispatcher will ask some important questions, like what's your exact location, so that help can be sent quickly and to the right place. If you're calling from a mobile phone, be very specific about your location. Don't hang up the phone unless the dispatcher tells you to. The dispatcher should help you remember the steps of CPR and how to use an AED if one is available. Once 911 has been called, you'll need to check to see if the person is breathing normally. Check for breathing for at least 5 but no more than 10 seconds. Look at the chest to see if it's rising as he breathes. If you see a person gasping, it's important to know that this isn't regular or normal breathing. A person who gasps usually appears to be drawing air in very quickly. He may open his mouth and move his jaw, head, or neck. Gasps may appear forceful or weak, and some time may pass between gasps because they usually happen at a slow rate. The gasp may sound like a snort, snore, or groan. If a person who doesn't respond isn't breathing normally or is only gasping, it's a sign of cardiac arrest and the person needs CPR.